doing very well.
Good.
But what about my patient?
How is our patient doing today? Kind of? So-so? Are you feeling better than you did yesterday? Oh, that's good. Do you have any questions?
Is it Ebola? I'm wondering.
No.
It's
not Ebola.
Oh, thank
No,
goodness.
just a fever. And last time I checked, her fever was down, so that's good. Can I listen to your heart? Okay. Well, it sounds nice and strong. Do your muscles still work? Oh, that's good. Are you ready to take some medicine? Okay. Let's get the medicine. Do you like to take your medicine with water or just by itself? Okay, there you go. You chew that up. Can I get you anything else while I'm in here? Yes, I will get you some water. Do you need anything, Mr. Pablo?
Smoothie. No, I'm just kidding. No, I don't need anything. I'm just joking.
Okay, well, she'll be able to go home tomorrow,
Oh, wonderful.
and then you should have no side effects from any of your illnesses, okay? You should be back to normal in a couple days. I've always felt that my nursing philosophy goes hand in hand with my personal philosophy, which is do unto others as you would have them do unto you, from Luke 6:31. I treat my patients like I would treat my family, and I often teach my students to do the same thing.
Excuse me, I gotta go make myself a smoothie. I cannot live 5 minutes without a smoothie. Oh,
Your dad's gonna go get himself a smoothie, okay? You wanna just sit here with me for a little while? Okay. When I was about her age, I was in the hospital for appendicitis. And I still remember, after all these years, calling for a nurse in the middle of the night because my IV hurt. And my arm was kinked up like this, and my arm hurt. And I called and called and called, and it probably wasn't very long, but when I was her age, it seemed like a long time. And finally the nurse came in, and she walked over and put my arm down and walked out of the room. And I'll never forget that experience because it was so abrupt and so impersonal. And that experience has stuck with me my whole life. And I've always tried to have very personal interactions with my patients to let them know that I care and that I'm concerned, and I like to joke and make sure that they feel comfortable as well. I've always based my nursing philosophy on the patient and patient-centered care. And working with families like I do now in the education system gives me a chance to not only work with students, but also their families. And this is a very fun part of my job. The education system is not used to the healthcare system, and so I'm constantly having to educate my parents on what we can and cannot do in the schools. Education and furthering my education like I'm doing now and getting my master's has always been very important to me. The ethical and moral codes that go with nursing seem to come naturally to me, and I think it's because of the way I was brought up and my values. But it's always important for me to keep those at the forefront of my practice and making sure that my patients know that I will treat them with the utmost respect and value that they deserve.
Hey!